In 1918, while Western Europe was engulfed in a deadly war, a new global horror was beginning. It killed at least 50 million people, more than 5 times the deaths of World War I. It was known as the Spanish flu, and it became the most severe and deadliest influenza pandemic to strike the 20th century. Few were spared from its effects, including Canada. In Toronto, more than 1,600 people died in a month. Hotels and private buildings were converted into temporary hospitals, and for the first time, funerals were allowed on Sundays. At least 50,000 Canadians died of the flu. Elizabeth Partridge was 8 years old when the pandemic hit Ontario. She was one of 5 children of former Ontario Premier E.C. Drury.
We were all sick, except Carl and Dad. The hired man had gone home sick, and Var was in his room. And this left Carl, at age just turned 13, and Dad to do the barn work and the housework also, and caring for 5 or 6 patients. My mother had fainted and was in the front bedroom. I remember Mabel and I just staying in bed and passing the time playing I Spy with my little eye until Aunt Mabel, who was a nurse, came over from our cousins where she had been helping out in the early afternoon. Many households were stranded in similar or worse conditions at this time of much sickness, and many thousands died.
There were 2 influenza pandemics that followed the Spanish Lady, one in 1957 and one in 1968. Neither were as deadly, but nonetheless killed approximately 2 million worldwide. We know that history will repeat itself.
Influenza is a respiratory infection, a virus that we see seasonally every year between the months of November and April in Canada. It is different from the cold in that this is a much more serious infection.
Influenza usually starts suddenly and may include symptoms such as high fever, headaches, and body aches. Seasonal flu viruses change a little every year, which is what makes us susceptible to them. We have some immunity, however, from previous flu seasons.
Pandemic influenza, however, occurs when there is a specific strain of the influenza viruses that spreads globally. It basically involves almost all the countries in the world with this one strain spreading, and that spread usually takes place over anywhere from 6 to 18 months, and you have waves and waves of it affecting the global population.
That means that a lot of us are going to get sick. The estimates are anywhere from, for a mild pandemic, to 15% of the population, to a moderate pandemic of about 1/3 of the population, and for a severe pandemic, up to half of the population.
Every year, the seasonal flu kills around 2,000 people in Canada. While a seasonal flu vaccine is available annually, it could take months to develop and distribute a pandemic flu vaccine. The flu can be spread when infected people sneeze or cough and release tiny droplets or small particles that can be inhaled or come in contact with the mouth, nose, and eyes of others. Hand-to-hand contact with an infected person or handling objects contaminated by the infected person and then touching your mouth, eyes, or nose can also lead to infection. People with the flu are infectious and able to transmit the virus for up to 24 hours before symptoms appear. Adults are infectious for 3 to 5 days after symptoms appear, while children are infectious for up to 7 days after symptoms appear.
In order for a pandemic strain or pandemic influenza to occur, there are 3 requirements. First of all, it has to be novel, meaning it's new, it's never been seen in humans before, and therefore we have very little immunity to it. Secondly, it has to be virulent, meaning it causes illness, severe illness, and deaths. Third, it has to also be very contagious. That means it's easily transmitted and contagious from one person to the next. So where are we right now? The best candidate for a pandemic strain right now, as we know it, is H5N1 avian influenza, or what people have been referring it to generically as the bird flu. It has two of the three conditions. What it doesn't have is the ability to be contagious easily from human to human.
While it is difficult to make exact predictions, every level of society will be affected. There may be disruptions in hydro services, public transit services. We may even experience food and water shortages. Life as we know it could change. One of the many unknowns is that we don't know what age group an influenza pandemic will target. The 1918 pandemic targeted young adults, so it had a socially devastating impact. The other two pandemics in the 50s and 60s had the same distribution pattern as with seasonal influenza. They targeted young children and older adults.
SARS was primarily an infection that spread relatively inefficiently, requiring close personal contact, almost entirely occurring within hospital settings. And the people at greatest risk were people who worked in hospitals or were patients in hospitals. There was relatively less transmission in the community at large. And the public health response was primarily containment within healthcare facilities.
Pandemic influenza will spread quickly through our communities. The best way to prevent infection is to avoid infected people. Practice social distancing, which means keeping an increased distance from others. Stay at least 2 meters away from a coughing or sneezing person. Stay home if you're sick. Cough and sneeze into a tissue or into your sleeve. Dispose of the used tissue and wash your hands right away. Practice good hand hygiene using soap and water or a hand sanitizer with at least 60% alcohol. Avoid large social gatherings like hockey games, concerts, or movie theaters. The federal and provincial governments are stockpiling antivirals or anti-influenza drugs to treat ill people during a pandemic. They're working on early treatment strategies to provide antivirals to people within 12 to 24 hours of the onset of influenza symptoms. One good thing to remember is that most of us will survive an influenza pandemic or suffer only mild symptoms.